A local mother with a special needs daughter noticed a broken link in our healthcare system and just how difficult it was to get services in a timely manner. She knew there was a need for change, so she formed the KOAA Foundation. That nonprofit partners with healthcare professionals and community organizations to find services and fill the gaps when it comes to health disparities. Our Bree Groves joins us with what the nonprofit has done for a mother and her son.
Yeah, the fact that they do this footwork to marry the families with what's available to them, that eases so much of the stress. And Christina Burdine actually reached out to me. Her son has special needs. Her husband travels an awful lot, and frankly, she needed the help. The KOAA Foundation has been a lifesaver for her and Hayden in more ways than one.
I do snowboarding, soccer.
Meet Hayden Hobbs.
Swimming.
The 23-year-old is heavily involved in Special Olympics. He's enthusiastic and a big part of our community. But his special needs do require a lot.
That's a 24-hour job.
Hayden requires a rigid daily routine where there is no stepping out of the box.
I can't decide, oh my gosh, I'm out of sugar, or I'm going to run to the store at 4 p.m. 4 p.m. is life.
Being the primary caregiver comes with a risk of burnout. According to the National Institute of Health, nearly all research studies have identified parents of children with disabilities to have an increased risk for depression and anxiety. The divorce rate is over 85%.
I desperately need somebody, and I'm near my breaking point. Or if I just need to go to the doctor because I can't.
The overwhelming feeling of figuring it all out. It's why the KOAA Foundation, a Colorado Springs-based nonprofit, partners with families.
They come in, we do an assessment, we find the gaps in their care, and then we make the phone calls and find the care that they need for them. And then those people, when they say they can help, call the family directly instead of the family trying to make a million phone calls.
The foundation does the footwork for families, from finding medical equipment to nursing services, primary and respite care, even doing home modifications.
Services can get expensive.
Incredibly expensive. Like, currently we're getting ready to switch to a different way. We're going to lose music therapy.
If Medicaid does not pick it up, that's another service Hayden loses. The KOAA Foundation finds a way to pay for what Medicaid denies.
Last days of her life, she was on a BiPAP 24/7.
Kim Randall started the foundation in honor of her daughter McKenna, who was born with a severe disability that left her blind and unable to walk or talk. She was fed through a tube, only expected to live a matter of hours. McKenna made it to 10 years old.
And just the struggles that we faced as a family trying to get services for her.
Kim and her husband were both active duty military, working opposite shifts, and after a year of struggling to get what they needed for McKenna, Kim made it her mission to overhaul the healthcare system for those with developmental disabilities and their families, regardless of where they're at financially.
You don't take any government funding.
Absolutely not. We're 100% private funded. I mean, we're pretty committed to that in order to keep the bureaucratic red tape and their regulations out of what we're allowed to do. So that allows us, when a family comes to us, to go, yep, we can help you.
Helping those like Hayden.
I'm an actor, I'm an athlete, and I'm a singer at the conservatory.
Recently got to show off those singing talents to help raise money at one of the KOAA Foundation's largest fundraisers.
I'll see your true colors, that's why I love you, so don't be afraid.
The KOAA Foundation is all volunteer. They have served 43 families, saving the community more than $40,000, and families on average $150 a month. So if you'd like to donate to help them grow their services even further, we have that information at KOAA.com, along with some fun fundraiser events they have coming up. I'm Bree Groves with News 5.